Welcome back. If you struggle with burning pain or tingling in your feet, Front Range Medical Center's chiropractor Dr. Dean Anderson can help. He recently joined us in the MHL studio to explain how he can free you from peripheral neuropathy. Take a look. Dr. Dean, for everyone at home, can you explain exactly what is peripheral neuropathy?
Peripheral neuropathy is specifically damage to the nerves in our extremities. So most of the time, Gina, it starts off in the ball, the foot, or the toes, like a numbness, tingling, and then eventually can become painful, burning, sharp shooting, electrical pain. As it progresses, it can work its way up towards the knees, but it's essentially, again, damage to peripheral nerves.
And what exactly causes this?
Well, there's a number of things that can cause it. A lot of people associate it with like diabetes or even pre-diabetes, but also autoimmune issues can cause neuropathy, chronic inflammatory problems. A neuropathy can be side effects of certain medications, chemotherapies, chronic use of antacids. So there's a long list of things that can cause it, and that's one of our objectives in the beginning, is to really understand why patients have it, what's driving it. A lot of people come in and they don't know why. They've been told it's idiopathic, meaning there's no known cause. And I always stress to those people there is a reason. So we try to dig, do lots of diagnostics, figure out why.
So people with this, and of course you at home, if you have it, you probably do know that, but what are people dealing with?
Now, a lot of frustration, and oftentimes the frustration just centers around the fact that it really changes a patient's kind of quality of life. I mean, with nerve pain, it can be difficult to sleep at night. Patients can have a hard time being on their feet because it's painful, so it limits mobility. A lot of patients have numbness, and with numbness, they have issues with balance because they don't know where their feet are in space, or they don't feel comfortable driving because they can't feel the gas or the brake. So a lot of frustration, Gina, a lot of hopelessness. Patients don't know what to do. They've been told nothing could be done for them, or they feel they just have to be on pain medications the rest of their life. So a lot of frustration.
That kind of numbness and that, I would think, would cause some long-term complications, no?
Yeah, I mean, it can. It's known to be progressive. So complications are really just the fact that it's progressing over time. So it starts to affect mobility, starts to affect balance. Patients become fall risks, and those are the main complications.
Well, your approach is really so successful and different from a lot of folks. What is that exactly?
Yeah, what we do in our office is a advanced form of electromedicine. So it's an advanced treatment technology we use specifically designed to address nerve issues and nerve damage. What makes this one of the more advanced forms of electromedicine is it incorporates really high frequencies and amplitudes of current. So with this, we're able to really get significant reductions in nerve pain, whether it's numbness, whether it's burning, shooting, stabbing pain. And as we start to improve function, the other thing that we do in our office is we spend a lot of time in addressing the underlying issues that's caused it, whether it's blood sugar issues, it's autoimmune issues, because we want to make sure, Gina, when this treatment technology gets nerves better, we want to make sure it doesn't come back. And so it's this comprehensive approach that allows patients to get better.
Well, I know so many of your patients, they actually see wonderful results from you, but they haven't always seen them elsewhere. Or why would you say that's the case? What is it that you do differently than others?
Well, I think when you, number one, the treatment technology and this comprehensive approach, but I also think when you look at like traditional treatment for neuropathy, it's pain medication, which can be beneficial. It helps with pain, but it's not doing anything for the nerve damage. It doesn't do anything for the underlying issue that's causing the neuropathy. So a lot of patients we see, that's what they've been doing. And so it's just kind of masking the symptom of pain, and that leads to the frustration. So really, when you have this treatment technology, you can address nerve issues, you address the underlying issue that caused it, patients can get results.
Love it. All right, there's also a phone number right there on your screen that you can call right now, 303-586-7897. If this is something that you feel is very, sounds like you're going through, or someone that you love is going through, go ahead and call that number right now. And in fact, so many of your patients have been successful. We're going to go ahead and listen to one of them.
When I first started coming to Dr. Anderson, I had no feeling in my feet. It was very, very difficult for me to drive a car because I couldn't feel the brake pedal anymore. What has happened since is absolutely fantastic. I no longer fear losing my balance as I walk. I have feeling in my feet and lower legs again, and driving a car makes me much safer on the roads than I used to be.
That's so great. Talk about why your office really is unique.
Well, I think one of the biggest things is I've been doing this quite a while. I've been specifically treating neuropathy for the past 12 years, and that's all we do, Gina. We don't see any other type of condition. 100% of the people coming in and out of my office have neuropathy. So I've personally treated over 1,200 cases, So we have a lot of experience. Everything is designed around getting results with neuropathy. So this advancement in treatment technology we use, the fact that we're addressing underlying issues, this comprehensive approach, there's a lot that goes into it for these patients who are dealing with this.
Well, you can see how excited they are when it works. So
Yeah.
Dr. Dean, thank you so very much. Receive a $27 consultation, which is normally $245. Call 303-586-7897. The consultation includes a review of your health history, a neuropathy-specific evaluation, and a review of past records to determine if you're a candidate for treatment. Visit denverneuropathy.com. Dr. Dean Anderson paid for today's segment.